Afternoon and good evening, depending on where you are. And so my name is Milton Kampel. I work at the Brazilian National Space Research Institute, and I'd like to thank Stefano and the organizers for the invitation to participate in this ESA EO4Health User Forum 2024. I also thank to all the audience here present today in person and remotely. Well, so the health of human population is constantly influenced by environment and patterns of territorial occupation, which is why the use of geotechnologies in the broader sense is in the analysis of the spatial distribution of health problems make it possible to determine the risk locations and also delimit some areas that concentrate more vulnerable situations. So the basic idea here is to comment on the use of first observation. In our case, considering terminology aspects, as Marcello raised up yesterday, we include remote sensing and geotechnologies in general. So applied to the study of water-associated diseases in Brazil. And at the end of this presentation, we'll make a few comments on the objectives of this workshop. And it is always worth saying that our aim is always to seek out and expand the partnerships and collaborations, developing joint efforts in capacity building, of course, according to common interests. So health surveillance can be related to care practice and health promotions of citizens in general, and the mechanisms adopted for disease prevention. So we try to integrate different areas of knowledge and address different topics such as policy and planning, territorialization, epidemiology, health disease process, living conditions and health status of populations, environment and health, and work process. From there, surveillance is basically distributed among epidemiological, environmental, sanitary, and workers' health. And what we can do in this context? So maybe develop efforts that can be useful for epidemiological surveillance insofar as identifying the main notifiable diseases, investigating epidemics that occur in specific territories, and acts to control these diseases. So environmental surveillance is dedicated to the interactions between the physical and social environments on health. So actions in this context have favored the control of water quality for human consumption and the control of disease transmission vectors such as insects, as you have seen yesterday. And in addition to advancing our scientific knowledge, it's important to train and qualify human resources, generate useful data, information, and variety of products that can be used in strategic actions associated with public health, collective health, the environment, and climate change issues. So water-related diseases are caused by microorganisms, natural toxins, chemicals, pesticides, and heavy metals spread or transmitted through water. So studies on these diseases cover environmental, socioeconomic, demographic, and climatic aspects, including hygienic sanitary conditions, access or lack of access to treated water, socioeconomic status, recreation activities in water, climate, floods, and environmental disasters, among many others. So the main modes of transmissions include the lack of water or an adequate sewage system, contact with the skin or mucous membranes, ingestions of contaminated water, and also vectors that thrive in water. And some of these diseases are notifiable in Brazil. So our group and colleagues have been carrying out studies on hepatitis A, leptospirosis, schistosomiasis, malaria, dengue fever, and other diseases in Brazil. Wherever this disease is of interest, it's important to know its transmission cycle. We don't have time to present the studies, but we will be available for clarification when or if required. We have also provided a list of last publications. So a basic overview of our methodological approach shown here illustrates the relationship between agents such as virus, bacteria, etc., humans, vectors, and hosts living in the same environment. So it seeks to use different tools and techniques to help us study transmission, habitat, and the environment by means of digital models. This type of approach in the universe of geoinformation can be represented here in the form of layers of different topics of interest, such as sanitation, drainage, houses, municipalities, or other geopolitical borders, satellite imagery, among others. And in this general flowchart that you don't have to go into detail, but we have summarized 4 main groups of steps that we employ in geotechnology-based studies of water-related diseases. So these groups relate to the source of the data or the databases, data processing, data analysis, and spatial analysis. Some or many of the references listed are from Brazil, but of course there are similar examples in other countries and regions, and even on a global scale, as Ravi has shown yesterday, for example. And here on the left below is just an example of a descriptive analysis of the social epidemiological profile and seasonality of hepatitis A in the municipality of Belém, state of Pará, in the Brazilian Amazon. And on the right, another study on social demographic and spatial temporal profiles of hepatitis A, which shows results on the temporal variation of notified cases of the disease, also by gender, educational group, and on the distribution of predominant infection among age groups. And here, also following the flow chart, are some examples of a study on correlations between environmental and social demographic data and hepatitis A transmission. And different remote sensing variables are used, such as the day and night temperature, vegetation indices, altimetry, and precipitation. You can also derive those from the cloud, such as Google Engine or Amazon. And cloud computing also made it possible to calculate turbidity, total suspended matter, and some hydrological indices, if you wish. So briefly, we show here different or a few spatial and temporal analyses in which, sorry for that. We also have some chloroplet maps, risk maps, using interpolation and an ecological model that we produced. On the left below, we have a risk of urban schistosomiasis transmission in the northeast of Brazil, using technique of map algebra analysis by neighborhood and according to environmental conditions. On the right, you have a space-time analysis of leptospirosis in 2 municipalities in Lower Tocantins, which is north of Brazil, and you produce a chloropletic map to show that census tract with higher incidence for leptospirosis were located in urban areas. And a heat map of the incidence also indicated that notification cases were mostly spatially aggregated. The results were validated by means of the Moran analysis, higher than 0.3, and the Lise analysis indicated that the spatial dependence of incidence was census tract specific. Okay, thank you very much. So we have covered a good part of our methodological flow charts. You could go on showing other examples, but you don't have the time. And so, but before that, I couldn't fail to mention the ON network, as Stefano mentioned. So the Open Network for Water-Related Diseases is dedicated to developing a network of scientists and stakeholders, sharing common interests in better understanding environmental controls on water-related disease outbreaks, the role of societal involvement in understanding and combating these diseases, predicting, early warning, and mapping water-related disease risks through the use of remote sensing and other Earth observation data, field observations, and mathematical modeling. You have some funding from UK GCRF, which expired at the end of last year. You are now in the process of transitioning to the Trevor Place Science Foundation umbrella, also participating in the region extension project and looking for new sources of funding. Now, regarding the objective that was proposed for the workshop, regarding objective 1, there are several factors that link it to waterborne disease transmission, and extreme climate events are very much concerned, especially for low-income communities, and lack of adequate sanitation and health care. So it's perceived that much of the burden of climate change will fall on developing countries, where the incidence of many communicable diseases has traditionally been high, and where healthcare systems still lack adequate coverage for health-related products and services. Now, regarding objective 2, one suggestion is exactly what we're doing here, bringing academia closer to managers. So bring together these two groups who do science and technology in the field of public and collective health with managers and policymakers, also with industry. It's important to consider different scales, different health systems in countries. That's a very important topic. And there are needs at the global scale to integrate those entities. The World Health Organization is here and now, and I'm glad to see that very much. And you have also mentioned that community is looking for analysis-ready data, so we should look to produce this type of information, but the ones which are of particular interest to health surveillance. So we have to provide data oriented to this sector that could be useful and really use it at the national level and at the international level. And finally, regarding Objective 3, sorry that I'm taking a couple of minutes more. One idea is to provide, besides data and software codes or scripts to link Earth observation data to health data and programming languages, promote more development associated with the health sector. I think that is very important. And also, besides the World Health Organization, also considering the regional branches of this, such as Pan American Health Organization and in other regions as well. And so the main message is to produce data for public health from an operational perspective. And finally, I just like to thank my colleagues, the supporting projects, and thank you very much for your attention.